Bone sarcomas are very rare malignancies originating from mesenchymal cells and include a variety of tumours such as osteosarcoma, Ewing sarcoma, chondrosarcoma, chordoma, and undifferentiated pleomorphic sarcoma, as well as other rare bone sarcomas. Primary bone sarcomas account for fewer than 0.2% of malignant neoplasms across all ages. Because of their variety and rarity, they can be uniquely challenging for many healthcare professionals who may not be familiar with the symptoms or poor outcomes of delayed diagnosis. Conventional osteosarcoma and Ewing sarcoma are the most common bone sarcomas. Their prevalence is higher in children and young adults. The most common signs and symptoms of bone sarcomas are non-mechanical bone pain and swelling at the site of the tumour. In osteosarcoma, localization is often at the metaphysis of the long bones. Ewing sarcoma is more often localized in the flat bones, but can also develop in the diaphysis of long bones, and less often the soft tissues. The most common sites in younger people are around the knee or in the upper arm. The main symptom, bone pain, is usually persistent, is often progressive, and is predominant at night. If a patient presents with these symptoms, then imaging should be performed immediately. If you then suspect bone sarcoma, the most important thing is to refer the patient to a sarcoma reference center for diagnosis and treatment under the supervision of a multidisciplinary tumor board. A biopsy and initiation of intervention should be facilitated by a multidisciplinary tumor board at a sarcoma reference center. Cure for these very aggressive tumors is possible with multimodality treatment, but only if the correct pathologic diagnosis is done soon and the best treatment is planned starting from diagnosis, usually systemic chemotherapy in conjunction with surgery and/or radiotherapy for local tumor control. However, a number of strategies using small molecule inhibitors and immunotherapies as targeted therapy are in development that will potentially improve patient outcomes. Getting the patient under management by an MTB in a sarcoma reference center can mean getting the right diagnosis in time, the optimal treatment strategy implemented early, and cure the patient. Delayed referral of the patient to the sarcoma reference center and tumor specialists reduces the chance of cure and worsens the patient's prognosis. If you suspect bone sarcoma, don't wait. Refer to a sarcoma reference center immediately.